Welcome to 2024. This is Jodi Schafer with HR Hot Topics for January, and you'll notice I'm joined by a brand new team member today. This is Gin Gibson, and I'm going to have Gin introduce herself in just a moment. But first, a quick little piece of background. For those of you that have worked with me for any length of time, you've seen the team grow over the years, especially in the last few years, and we had gotten to a sweet spot size-wise, and I thought, no more. We're done. This is as much as I can handle. We've got all of our bases covered. And there are two areas of service that HRM services really never touched. One of them was payroll, which is still going to continue to be the case. And the other was benefits. Well, Gin and I have worked together for years, and Gin was a client contact of mine long before she joined our team. And benefits is what Gin knows best. So all the compliance side, the employee and employer component of it, and because we get so many questions around this, and it's really something I think many of you could benefit from assistance with, when Gin said she was looking to maybe make a change, I jumped right in and said, "What, do you want to come work for us?" It's kind of how it always works, right? So I'll have Gin introduce herself to all of you and share a little bit about maybe some of the services that she can help provide through HRM services under the umbrella of benefits. And then she's going to talk today about some things that you should be thinking about and then things you should actually be doing now that open enrollment is done. So without further ado, Gin, take it away.
Thanks. So I have been doing benefits all of my career, and so I actually do have certifications. I have one that is called a Certified Employee Benefits Specialist, and then I have another which is a health insurance counselor licensed through the state of Michigan, which means that I have a lot of knowledge about how to explain benefits to employees and employers if they need help with that. I know about the ERISA regulations, which is a federal regulation that all employers need to follow, and I know how to look at a benefit plan and help people determine what they want to offer to their employees.
Yeah,
so
make the most of their money.
Right.
So a few episodes back, we actually had that as a topic, getting creative with your benefit strategy. And it can be really challenging if you're an employer. You know how much money you can afford to spend, but which benefits will get the most mileage for you and which ones are going to be most appealing to your employees is where it can sometimes be a struggle. And oftentimes your agent might be really well versed on the health insurance piece. Gin's going to come at it more holistically than that. So obviously brings that health insurance expertise, but is going to look at the retirement plan and some of the other things that you're probably already doing or maybe didn't even know you could do that would maximize both the dollar. And I think that's a real value add. Right. So I'm excited about that piece of it too.
Right. Yeah. So should we go into what some of the things we
let's talk about things that you should be focusing on now that open enrollment is done. And I know not all of you are necessarily on a calendar year for your insurance plans, but it's, I think, the most common. And so now that we've sort of wrapped up 2023, this is just a good time to be looking ahead. Some of this is kind of early days post open enrollment, and some of this I think is just best practices going forward.
Yep. So these are things that I always tried to do at the beginning of the calendar year for the employees when I was working at my former employer. But it basically, if you're changing your insurance carrier, or even sometimes the insurance carrier needs to change something on the ID cards. Mm-hmm. So nowadays, a lot of those ID cards are mailed to the employee instead of to you, that you then give to the employee. So it's always a good idea to check with the employees to make sure that they receive that ID card. That's going to avoid those panic calls when they're at the pharmacy or maybe even the doctor's office and realize that they don't have their ID card. Another thing to always make sure you're distributing, this is actually federally required, which is that summary of benefits and coverage. Basically, that's a document that every insurance carrier has to follow. It has the same format. And so it's a simplistic way for employees to understand their benefits. So you're supposed to give it whenever someone is new to the plan. You should always give it out annually during your open enrollment or right after your open enrollment. It should be accessible to the employees. Sometimes, actually recently, the federal government has changed the format of the SBCs, that's the acronym for it, and so you need to distribute that again, even if you have done it in the past.
And this comes from where? Where would an employee get access to this?
The insurance carrier always typically creates it, and your agent should give you that.
Okay.
Is where it
So
should
if you
come from.
haven't gotten something called the what was it? Summary. I'm looking at our cheat sheet. Summary benefits coverage. You can
or SBC.
Clearly, this is not my area. If you haven't gotten that from your agent or from your carrier,
You need to ask
You need to ask for it, and then that goes to every single employee.
Everyone that has enrolled in the plan.
Can you give it electronically, or do they have to get a paper copy?
So all of these ones that I'm talking about that are federal, there are required guidelines on how to give it.
Okay.
And so I will.
And it's not all the same?
It's all the same, but there's a lot of if-then type things.
Okay.
So we can link that to
Perfect.
give them.
So again, look at the links.
Yep.
That's where the value is, right? Okay, so we'll add information about that in the email message. Great.
And then the other 2 times you would want to give it is special enrollees. So think about someone who has lost their coverage from their spouse's employer and now are going to enroll into your plan. So you should give it at that point. And then it always needs to be available upon request.
Okay.
Second document, which again is required, federal regulations require it, which is called the Women's Health and Cancer Rights Act notice. You can get this template notice from the DOL, Department of Labor, and we can link that again.
Okay.
And basically, it's a document that should be given to everyone that is in your plan, and it tells them their rights when it comes to mastectomy benefits.
Okay.
So
Is this new?
Nope. It's been around for a long time.
Well, I wasn't doing this when I was in house.
I don't think a lot of people are doing it. That's why I thought I'd bring it up.
Oh, that's perfect.
So,
Okay, great. So 2 documents then, right?
yeah.
Are there more that are coming
That
that are mandated?
There's one more that's mandated in the fall. It has to be given out by October 15th. It's
Okay.
called it's the Part D coverage. I can't remember the official, but basically it's a document that has to be given out by October 15th because that's when open enrollment starts for the Part D prescription drug plan for Medicare. And it tells your employees whether or not the coverage they currently have through you is equal to or better than the Part D regulated benefits.
Okay, so no matter how old they are, whether or not they have Medicare, you just give it to everybody.
Technically, you only have to give it to people that qualify for Medicare.
Okay.
Procedurally, it's easier to give it to everyone because you don't know spouses who qualify.
Okay, so if you're keeping track, folks, 3 documents that you're handing out this year, 2 on the tail end of open enrollment, 1 by October 15th. Okay, and we'll link to all 3 of those?
Yes.
We'll link
Yep.
to all 3 of those
Yep.
for you.
The other thing I always like to remind everyone is to look at their invoice, their January invoice, if that's when your premiums have changed. Especially as a small employer, if you have under 50 employees, every single age has a different premium. So you want to make sure they're all accurate. And it's the age as of January 1st.
Of the employee.
Of the
that's enrolled.
employee or dependent.
Okay.
So insurance carriers make mistakes, and it's a lot easier to fix it in the first month and not the 3rd or 4th month.
Right.
So that's
So
why
one
I
of the
always-
things, Jen and I were kind of going over this best practices before we turned the camera on. And I said, one of my clients, the bill they got from their carrier each month was a lump sum bill. It didn't have the itemized invoice attached to it, which made this, piece of advice tricky to follow. And one of the things that I was responsible for when I was in-house was doing exactly this, making sure every month when that bill came in from Aetna or Blue Cross or PHP, whoever you get your benefits through, I was going through that itemized list of employees and checking to make sure that I had the right employees on the list. If anybody dropped that month because they separated employment or got insurance elsewhere, that we weren't being billed for them any longer. If somebody had a baby, right, and the coverage was going to change. I was looking at that every month and very regularly found errors. So benefits are expensive. You know this, especially if you're picking up a large portion of those. If the employer is picking up a portion of that cost, you don't want to be overcharged for things. Or an employee thinks that they've had benefits. You're taking deductions out of their check, and lo and behold, their name was never on the list to have coverage. You don't want that panic phone call either. So look at it immediately that first month, and then look at it every month thereafter, or at least quarterly take a look at it, or anytime you know there's been a change. You know what's going on with employees. So take a look. And I was asking Jen, so if the if the bill you're getting right now is a lump sum bill, how do you get access to the itemized version?
You can contact the carrier or even through your agent to get the itemized. And the other thing that if you don't get with your renewal package, you can ask for. It's called member level rating, which basically, like if you have a family of 4, Gin Gibson, X amount, Tom Gibson, X amount, and then 2 children, X amount. And then at the bottom, that will have the total amount.
Okay.
So you could compare that to the rolled up
Invoice that you're seeing
too,
on there. Yep.
right.
Yep. And then you would also mention on the payroll side.
Yep.
Right.
If you're doing premium contributions, if you're requiring premium contributions, I always like to encourage employees to look at that first pay stub to make sure the deductions are what they're expecting. Especially if you're doing percent contribution, premium contribution, and you tell them, your premium's going to be $1,250 each month. And 10% of that, so they know how much that your total is paying. And it
Not
helps
just
them,
their piece.
right? It helps them value their benefits a little bit more.
Yep.
Is what I've always felt.
Yep.
And then the last 2 things, just real quick. The carriers always have marketing materials that are geared towards your employees, their members, and it helps. Generalized documents to help explain their benefits. It's not going to be specific to your plan maybe, but like a document that explains the different terms, what deductible, what a deductible is, what a copay is, different things like that. You can get those through your agent, and I think those are great to distribute to the employees quarterly, however, whatever works for you.
Sure.
It helps them.
It could even be something that you go over in a staff meeting or a quarterly meeting where you stand up there and actually walk through it, because sometimes you give folks paperwork and it just goes right in a folder, or it's an email and they move it to the read later file. It never gets read. So being proactive on some of that too. And I think, again, to your point about valuing the benefit coverage that especially if you're paying for it or paying a portion of it, so they know what it means and how to best use it.
Right. And then the only other thing I always like to make sure you remind the employees you're available for questions. Employees may not feel comfortable asking you questions unless you let them know that you're available to do that. So that's the last.
And on that note, great springboard here. If you have questions about your benefits, when I was in-house, my agent was my go-to. And sometimes my agent did a really great job on the education side and helped me understand things and gave me information so my employees would understand things. And other times I felt like it really fell short. So always check with your agent first, because you're paying through premiums and the kickbacks they get from those premiums for that service. But also now, because we have Gin on the team, if you have questions about anything benefit related, especially the compliance piece, you can now reach out to us as well. So Gin's email will show up here at the bottom of the screen. As always, you can have, if you have questions, you can reach me directly, Jodi Schafer at workwithhrm.com. With that, we will both leave you. Welcome, Gin.
Thank you.
So glad to have you. And we'll see you next month in February.